Hello everyone, welcome to Study Nursing by Sense Goals. Today in this video, we are going to discuss about some of the DHA questions and answers, and that is intended for helping the nurses clear their DHA exam. If you're somebody who is looking forward for studying such licensure exams, make sure that you watch the channel for more related videos. In this video, we are going to discuss about multiple choice questions. You're also going to see the answers explained. At the same time, you would be given the rationale for the right answer. I'm also going to give some of the tips to easily remember the answers. And at the same time, we are going to touch other related topics that would benefit or help you to clear the exam in case they are asking for any of the related topics. All right. So, that being said, if you are someone who is watching this channel for the first time, let me introduce this channel briefly. It's called Study Nursing by Sense Goals. And in our channel, we introduce the nurses, the student nurses, and the nursing aspirants who wish to go and work in different countries with topics such as nursing diagnosis, detailed nursing care plans. We also have got wonderful drug studies made, short notes on diseases, assessments, and multiple choice questions and nursing quizzes. All right. So if you're ready to spend 15 to 30 minutes during the day, if you are a working professional, if you are somebody who has not been working and you have plenty of time, make sure that you dedicate at least an hour during the day or the night for your study. And I can guarantee that you're going to pass the exam with ease. All right. So, all said and done, let me take you through the questions in the video. It's going to be a short a briefing, but the questions are of like low to medium complexity that I've taken. Feel free to watch other videos related to other exams so that you are having a broader idea by not constricting you to only the DH exam, but instead, if you go ahead and look at the NCLEX exam models, the hard or the prometric model, you will feel more confident and you would be much ready to answer the question with more clarity. All right. So let me take you through question number one, which is asking for the normal adult blood pressure range. So most of you might be knowing it's 120/80, but in this slide, we are going to also discuss about hypotension, hypertension, and the stages of hypertension. If someone has blood pressure below 90/60 mm of Hg or mm of mercury, it is considered as hypotension, which is low blood pressure. When it is hypertension, in stage one, any value between 130 and 139, and the diastolic value of 80 and 89, we call it as hypertension stage one. And any values above 140 and 149, and the diastolic value of 90 and 99, we call it as hypertension stage two. I'm pretty much sure in your country or in general practice, we generally say 140/90 is regarded as hypertension. So that's also could be acceptable. I'm also here to give you a tip on remembering systolic and diastolic. If you are someone who always confuses between these values, so I'll share my experience how I have learned. So I consider systolic as a sister, and diastolic, the D comes with the doctor or any of a terminology that you can remember, but make sure that I have what I have learned is I've kept a systolic as sister, and I, being a nurse or a sister, I've kept myself on priority, and that is the value that comes first. No offense, no bad feelings for any other professionals or any other doctors, but This is how I have learned. So in your case also, let me know in the comment how you have learned, or were you intelligent enough to remember a systolic and diastolic value without confusion. All right, let's move to the question number 2 now. It's regarding the respiratory rate. So it has given a couple of options. So let's see what the correct answer is. It's 12 to 20. So you can, if you're trying to learn, I would say, you can actually learn about bradypnea and tachypnea. That would facilitate your learning and help you understand about the breathing rate or a respiratory rate better. So if someone has a respiratory rate below 12, it is considered as bradypnea, or respiration below normal. And if the respiratory rate is about 20, it's called tachy or tachypnea, or increased respiratory rate. Remember, the respiration is counted for 1 full minute. It's not counted for 5 or half a minute and multiplied. Never. It's counted for 1 full minute. And also make sure that the patient was resting when you were taking the value, because if the patient is sleeping, or if the patient is like really resting on a deep level, you might not get the real value. At the same time, if the patient has just returned from walking, or using the stairs, or just any activities, you could not get the normal value. So it's important that you assess the patient while the patient is on a resting level. All right, so we've covered a whole lot of general knowledge and assessment features along with this question. I hope you can remember all of them when you are trying to answer related questions to these. And let me know in the comment if you can also relate to similar terminology, which is bradycardia and tachycardia. So remember, when you're learning, try to associate and learn so that you would not forget. That brings us to question number 3, which is asking for potassium value in the blood. So it is 3.5 to 5.5, or 3.5 to 5.0 millimole. There could be chances if the options are given 3.5 to 5.5, even I have seen them. But in this scenario, try to have a closer look at the values. And even if you're not sure, you can really look for some of the answering rationale. For instance, the answers can never be 7.0 to 9.0, because that looks like a very higher value. At the same time, 1.5 to 2.5 also doesn't look right. Then the answer has to be B or C. So try to use such rationales when you're answering the question. At this slide, at this moment, when you know the real value, the normal value, let's also discuss about hypokalemia, which is low potassium in the blood, and hyperkalemia, which is higher level of potassium in the blood. There could be some of the disease condition that you can remember when you have hyperkalemia, conditions such as chronic kidney disease. In case of renal failure, you can have higher potassium. Also, hypokalemia is a situation where your body has less potassium, less electrolyte. You can think of conditions such as severe dehydration. That includes nausea, vomiting, diarrhea. When hypovolemia, when the patient is losing a lot of fluids. These are all the situations where you have low potassium in the blood. Also, you could get similar question related to diuretic. For instance, what could be the complication when a patient is on furosemide or Lasix? What's the thing that you would generally monitor? So in those cases, you can remember, when the patient is given diuretic, they can lose the electrolyte as well as water. When they are losing the water, they are also losing the electrolyte that includes potassium. That's why in some cases they are given potassium sparing diuretic. Now let's think of any example that comes to your mind when you think of potassium sparing diuretic. So all are related, I would say. But don't worry, in the coming slides and the coming videos, I'm going to guide you regarding all these related questions and answers. Let's move to question number 4, which is nursing intervention is a priority when the patient has chest pain. So these are the options you have in front of you. Try to remember when you have a question related to chest pain, related to CPR, BLS, basic life support, unconscious, etc. Your primary thing should be to consider airway, breathing, circulation, ABC. To clear the airway, make sure the airway is patent. Anything related to oxygen is coming or there in the option, you go for it. Most of the cases, it could be right. So in this case also, when you have a patient with chest pain, your priority should be to make sure that they have the oxygen, and then you go for all of the rest of the interventions, all right, including calling for help. Then we have question number 5 in front of us. It's also somewhat related. So it asks about your first action if you suspect a patient developed pulmonary embolism. In most of the cases, I would say you can, when a question is given and it has the terminologies like when you are suspecting, when there is a chance, I would advise you to take off or ignore that and then look for the real keyword here. The real keyword is pulmonary embolism. When they say you're suspecting pulmonary embolism, there could be a chance, there could not be a chance, but since it is an emergency situation, you cannot take risk and suspect that it is not, right? So in that case, you really gonna consider that it is happening. I'll give you another example. They can even ask a question if you suspect a myocardial infarction or a heart attack. If you're suspecting a heart attack, if you're suspecting pulmonary embolism, if you're suspecting a hemorrhage. So in all these questions, remove that suspect and focus your eyes on that keywords, which is pulmonary embolism or heart attack or myocardial infarction or chest pain or hemorrhage. All right. So let's have a look at the answer. So the answer is administering oxygen, like I said. So let's have a quick look at what pulmonary embolism is. It is a condition that occurs when the blood clot is developed in the blood vessel elsewhere in the body, and most often it is developed in the leg. And this clot or emboli travels to an artery in the lung and suddenly forms a blockage in the artery. And you could also think about or learn about the warning signs of PE or pulmonary embolism here. So the first or the primary symptom would be shortness of breath. That's a classical symptom you see in the patient. And also, it's interesting to note that the chest pain is of sharp in nature. So, the chest pain that may become worse when breathing in, that is so sharply felt that you may think that you're having heart attack. And the patient could also present with lightheadedness, dizziness, and passing out due to sudden loss in the blood pressure. So you can imagine when the artery is blocked, the circulation is blocked, and when it is blocked, you can imagine all the signs and symptoms that accompanies. All right. So I think with this slide, you have learned a couple of things. You have learned what pulmonary embolism is. You have also learned the classical signs and symptom, which is shortness of breath and sharp chest pain when the patient takes in the breath. And also the most commonest cause is an emboli, which usually develops over the leg. That's how we recommend using stockings in patient who are mobilizing less. So you might have learned about deep vein thrombosis that has a complication or that could cause pulmonary embolism. So we prescribe or we recommend the patient to use the stocking, or even the heparin is administered, or the heparin is ordered for a venous thrombus embolism, all right, VT prophylaxis. So a lot of topics discussed over here. So with this, let me take you through the next question. What is the purpose of measuring central venous pressure? If you're somebody in the ICU, you can easily answer the question. It's too easy for you. But if you are starting your career, if you haven't been to the ICUs or theaters, or any of the acute care places, it might be a bit tough for you. Make sure that you watch the channels and watch out for any of the short notes we would be publishing, including CVP, central venous pressure. Well, speaking about CVP or central venous pressure, it's the blood pressure in the vena cava near the right atrium of the heart. Okay, the CVP reflects the amount of blood returning to the heart and the ability of the heart to pump the blood back into the arterial system. So let me also take you through the normal CVP level. It's 2 to 8 mm of Hg. I have learned it through yet another funny way. So I always consider or say to myself that compared to the blood pressure, since it is a heart chamber, the pressure is quite less, and also it's a venous pressure, it's not arterial pressure, so it's definitely going to be very less. And then I have simply said in my mind that it's primary school rather than the high school. So 2 to 8, grade 2 to grade 8 is what I used to think, and sometimes I have learned it that way. Let me know in the comments, or I'm just wondering, when you are listening to this video, how you have learned the normal values of all these things, because there are a whole lot to study in nursing. All right, so let's also have a look before we move to the next question. Let's also have a look at how it is measured through a pressure transducer. So usually you have a line, and the line is connected to a pressure transducer. It's a connector thing, and the connector thing is then attached to the monitor that would display the central venous pressure. All right, and usually the catheter is inserted to the thoracic central veins, that includes the internal jugular or subclavian veins. All right, so this is how they measure the CVP. All right, so let's move to the next question. How is a urine culture obtained? So you have all these options before you. This question could also be asked in a way that is situational. So you're working in a unit and caring for a 40-year-old male who had the complaints of high temperature. His WBC is elevated, and the doctor has ordered for a urine culture. And what would you be doing? All right. Or given the situation, what could be the investigation that could be done? All right. So let's see what according to the option, what is answer. So the answer is a midstream urine sample. If you look at the other options, it's very uncommon that you collect the first morning urine unless and until you are told to do so. And 24-hour urine is usually intended for if you're suspecting diseases such as pheochromocytoma or any other classical or severe situations or a disease condition. And catheterized sample, you cannot always catheterize a sample, catheterize a patient, or you cannot always expect that the patient has catheter in order to obtain urine culture, right? So in that case, definitely B is the answer. And let me take you very quickly through the procedure, how you would educate the patient to take the urine sample. So you ask the patient to clean the urinary meatus, as you need to give special instruction if for someone who is male or someone who is female. After cleaning their urinary meatus, they can actually collect the urine in a small container, make sure that they are not touching the lids or touching the brim of the container, not to contaminate, and let them void for some time, and then they can collect the midstream and then close the container you have provided, and then they can void the remaining urine onto the toilet. So this is how you collect the midstream urine. So you have learned about the urine culture, you have the midstream urine collection, and also we have discussed some of the situation where we collect different types of urine. All right, that brings you to question number 8. Which is a priority nursing intervention for a patient with hypoglycemia? So you have a patient with low sugar, and what is the priority? So make sure that you look for the keywords. It's priority and also low sugar, which is hypoglycemia. All right. So if you look at if you're thorough with the management of diabetes, it could be very easy for you to answer the question. Option B is the answer, because rest of the questions are actually for decreasing the blood sugar. If you look at the question, the patient already has decreased blood sugar. So all the rest of the options, if you are exercising them, can bring down the glucose further, which is dangerous. So make sure that you read the question really carefully and then answer. So I don't think you could, we could discuss any of those things, because I assume you already know about these. So that's it. Let's move on to question number 9. What is the antidote of warfarin overdose? So this is something that I think you need to learn. Otherwise, it could be tough for you to answer. But I can give you an easy way to remember. I can tip you with an easy way to remember. It's VAWA, that is warfarin vitamin. So warfarin antidote is vitamin. The both starts with kind of war words. So try to remember in that way, all right? No more explanation other than this. Moving to question number 10. What is the most effective way to prevent the spread of infection in the hospital? So, when we think about it, infection in the hospital is otherwise called as HAI, healthcare associated infection or hospital acquired infection, or we call it as nosocomial infection. What is the most effective way? We all have come through COVID. We have made it possible that we thrived on earth. That was mainly because we used hand hygiene practices. So the answer is hand hygiene. Cleaning your hands can prevent the spread of germs, including those that are resistant to antibiotic. In our channel, we have also made short notes on nosocomial infection. You can have a look on that. I'll make sure that I give a link at the end of the video. With this, we have come to the end. I hope you have got some knowledge. You have got some information about how the questions look like, how to modify your answer, how to eliminate, and how to think about the related topics when you're viewing the questions. If you are somebody who is looking forward to clearing the exams or having a bright career anywhere in the world, make sure that you subscribe to the channel. Spend 15 to 30 minutes a day and see for yourself how your career is improving and you're feeling more confident. With this, I really want to thank you for the time, and I really want to wish you good luck for the effort that you are doing for towards your exam. Thank you so much. Wish you good luck.